Nearly 1,000 students classified as high risk for their potential exposure to the meningitis disease were evaluated last week here at the Cal Poly Health Center. According to the California State Public Health Laboratory, the strain of meningitis that led to the death of one SDSU student is known as serogroup B. Currently, there is no vaccine for this particular strain of meningitis, but the antibiotics given out here at the health center are said to be able to mitigate the effects. Greg Lichtenstein is the director of Student Health Services.
What's recommended is preventive antibiotic treatment, and that can involve one of three antibiotics. The preferred antibiotic is ciprofloxacin or Cipro, 500 milligrams. It's a single oral dose of medication, and that's it.
Student Health Services will continue to monitor health on campus. And according to the CDC, in 95% of cases, only one individual is infected with the disease. In most cases of meningitis, 80 to 90% of people infected ultimately recover. Cleaning your hands often, routinely cleaning surfaces and disinfecting them, handling and preparing food safely, as well as avoiding contact with wild animals are just a few of the steps that the CDC advises people take in order to avoid infection.
If anybody notices onset of fever, intense headache, neck stiffness, lethargy, and also this, when it gets into your bloodstream, can result in a rash that kind of looks like little bruises that get bigger and bigger. So if somebody has a non-blanching type rash and fever, they should take that very seriously. They shouldn't be coming to Student Health Services if they're symptomatic. This needs to be treated as soon as possible. That person needs to go to a local emergency department.
It's important to note that the bacteria that causes this particular strain of meningitis is not airborne, and it's not as easily transmitted as some strains of the common cold or the flu. Reporting from the Cal Poly Health Center for the Daily Aztec, I'm Quinn Owen.